The antenatal clinic at Macaulay Street in Freetown is back in business. These babies are being weighed and receiving routine immunisations. When Ebola arrived in Freetown, suspected cases started walking in seeking help. With the clinic also caring for other patients and babies as vulnerable as these, managers had no option but to close. But now, apart from the extra level of protective equipment these nurses are wearing, you wouldn't know Ebola was here at all. But just round the back of the clinic, one of the dedicated Ebola ambulances is pulling up. They've come to collect Ebola-positive patients who've been cared for in a small isolation unit attached to the health centre. They're now very weak, but have received drugs and rehydration, and most importantly, they've not had to wait at home, risking others with infection. After 4 days in isolation at this small community Ebola unit, some treatment beds in a bigger clinic have been found for these patients. They're now being transferred by ambulance to there. The concept of a small isolation unit attached to an existing community health clinic was pioneered by a British medical organisation, but it's being entirely run by local health staff.
There are some patients who have been isolated in this unit and then their result came positive. We sent them to the treatment centre and they've survived the disease, and they've been coming here to say thanks to our team.
The hardest, most dangerous job is done by the cleaners hidden behind the masks who keep the clinic safe and operational.
What I get for tell the people no more we dey afraid for do this job. I want let them know say this sickness here not to person bring an at the country. Now by through God in your own power make this sickness can at the country.
This small Ebola isolation unit took less than a week and cost less than $10,000 to build. And it's successful because it's next to this community health centre, which is still able to operate like it did before Ebola arrived. Now, the British government have made enough money available to build 200 more isolation units like this. But unless they're set up and managed properly, experts here say they could be disastrous.
The units that are set up, they have to be like the ones we've set up here, that they're attached to medical facilities where people present anyway, and that they can come and they know they're going to get the care that they deserve and that they need. If you simply set up a community holding centre without this and without the support of clinicians to come in and do the treatment and start the treatment as soon as possible, no one's going to come. The infections will stay in the homes and the families will get infected and they will continue to die, and it won't have achieved anything and the money will have been wasted.
These patients chose to come here and be isolated, but on average, every 10 people who get infected with Ebola here lead to 17 more cases. All of Sierra Leone's people are now at risk, especially its poorest. €1 billion of support announced by the UK and the rest of the EU will help, but only if it's spent wisely and quickly. Tom Clarke, Channel 4 News, Sierra Leone.